Hello and welcome to this webinar. Today, the first webinar in 2022. My name is Holger Kast. I'm the head of training education at TRI, and I'm going to lead you through this webinar with the world famous Agnini brothers, with Dr. Alessandro and Dr. Andrea Agnini. We have a really great topic today. It's the digital implant revolution. And before I would like to give the word to the Agninis, I will take the chance and go through some slides from my side. And I would just like to give you the information when you have any questions during the presentation today of this 1 hour. Please write them in the question fields on the right side in your toolbar of the GoToWebinar tool. You have the question field and you can write all your questions in there, and then I'm going to pass them at the end of the Agnini's presentation. I will pass them to the doctors, and then we can talk about your questions. So before I welcome you guys, I will start with my presentation. We are here together because of the digital implant revolution. And I think before you guys show us your great cases you've done also with the Matrix system in the last year, I would like to take the chance to introduce those customers or those participants who are not know about the Matrix so far, a little bit of this revolutionary implant which TRI created in the last years, and we already have the 15th month of CE marking. That means we started also with the Agnini brothers already more than a year ago in a key opinion leader phase with this new implant system, with the world's first digital implant, which you already can see here on this picture, the Matrix implant. So the Matrix implant, we say like we have no abutment, we don't need an abutment, we have no cementation, and we have no limits. This is because we redesigned the connection, the implant connection into the new world. Because all implants which we have in the market so far, they have internal hexagon connections, octagon connections, sharp corners inside, and we have also the new world in the dentistry, and this is the CAD/CAM technology, and this is also the zirconia materials which came into the market the last, let's say, 10-15 years. But the inner connections of the implants did not very much change over the last 20 years, I would say. And that's why we have always, and I know that the Agninis will show also some Thai-based digital prosthetics, and we have in this moment, we have in between the old implant world and the new technology world of CAD/CAM technologies and zirconia technologies, we always add a Thai base to connect these two worlds. And that was actually the idea behind the system, the Matrix implant system. I just have added this video shortly that we understand. We have here a hexagon connection, and these CAD/CAM technologies, drilling machines, 5X drilling machines, they have always this drill, which cuts the product, the zirconia, for example, and it will always have small round areas where it should be a corner. That's a big issue. And that was actually the most important point for us from TRI to develop and created this idea of the Matrix implant system. Again, we see here the Matrix implant. You can see it's a very smooth, round, 20 degrees angulated round connection here with one rotational lock, which you can see here. This is just a one rotational lock. So a very simplified connection based on all the our days CAD/CAM technologies and also material technologies, for example zirconia, which has to have like a very flat basis to be really stable based into the implant connection. When you see here, you can see a not sintered crown, which is milled with all the digital implant strategy, milling strategies we designed for all milling machines, for for all CAD/CAM milling machines in the market, we designed so-called milling strategies to be able to mill even in a high quality chairside milling machine. We can mill this super accurate connecting surface here, and you can see that that's an STL file which normally mills a crown or a prosthesis in any material. And you can see here already in the not sintered part that it is very accurately milled. And the slide here shows also the right side is the matrix connection milled with a standard milling machine in your laboratory or in any milling center, in a certified milling center, TRI certified milling center. They are all able to mill on 2 microns, exact and accurate, a perfect fit into this matrix inner connection. Comparing to a tie base from TRI made in Switzerland, you can see here the roughness of the hexagon connection. We mill a tie base, or we produce a tie base in Switzerland, and compared to a crown and this connection, the matrix connection, milled in standard milling machine in a laboratory which is certified by TRI to be allowed to mill the matrix. So this is possible. This is the new world. This is the digital world. Really great, before I pass the word to you, is that we not even only have the CE mark, we also have reached and approved, we are approved by the FDA. So we will, in the future, we will also free America, and not only America, I think we will free in the future with the matrix implant system, and with the help of our key opinion leaders like the Agninis, we will free the world from abutments and cement. And this was my last slide before I would like to introduce you to Andrea and Alessandro Agnini. We had already a really nice launch event last June in Switzerland together, and so the Agninis have already a lot of experience with the matrix implant system. And I would like to go ahead, introduce yourself. I make you as a speaker here, and then you can start with your presentation. Please go ahead. Welcome.
Great, Holger. Thank you for the kindly presentation. For us, it's a great pleasure to be here in this webinar and talk about the new connection, the new matrix connection in our clinical cases, Andrea.
Yeah, it's a great pleasure also for myself, of course, for us being part of this revolution is absolutely important, because we have been doing research, we have been testing, we have been trying all these technologies that in the last 10 to 15 years came out in the market, and this was exactly what guide us into this revolution. And today we're gonna deep dive you in what has been really a great idea, a great concept behind the matrix implant, and we're going to show you what, together with 3implant, we have done in the last year, documenting cases, exchanging ideas, seeing what could have been improved, because absolutely, like every technology, we need to have a learning curve, but only if you believe you can create really a disruptive technology. And we believe that this implant really can change many different point of view. And in order to start, we just want to do one step back. We just want to let you know what is a digital revolution all about. I mean, we should create workflows which don't decrease the quality of our restoration that we had so far, that are time and cost efficient, and especially which are patient friendly. So it's not that we have to complicate our life, we have to simplify our life. And so this is everything that we have been doing, like creating new digital workflows, which, as I was saying, they should be smart, they should be simple, and they should be predictable. And here we have one of the established protocol that nowadays we have, which is the scan, plan, and restore, which has been utilized in the last 5 years with with good success.
Yes, when you buy the technologies, it's very important to become the technology a routine in our office, to avoid to place the technology in the corner of our office. And here you can see some cases restored in the last year. In the last year through the CAD/CAM workflow and through the technology in the office.
And you see that 3Implant has been always like involved in the digital revolution, because this is a case done on 3Implants, on the classic 3Implants with the scan body that we utilized for a good while, always projected and produced by them, and also with the titanium base, which of course it's a great tool. It has been a great tool so far, because 68%, and we will see some of the data later on, 68% of the CAD/CAM restoration nowadays are on titanium base. And so you see that in our learning curve, we were able to understanding how to scan, which kind of scan body to utilize. In this case, there was also a model, so we have utilized also an analog, a digital replica of the implant. And then, of course, with our lab technician, in this case, Simone Maffei, we were able to finalize these 3 implants screw retain unit bridge. But as I was saying, it's not only technology, and you can appreciate also from this image, it's technology, it's companies, and it's also what? Materials. Because what we were able to achieve through digital dentistry was to standardize our process, to shortening our passages. And of course, without the marriage, the perfect marriage or the bonding that we have between intraoral scanning and material evolution, we could have not achieved this kind of standardization.
Yes, in fact, if you manage cases in massive intercustation, especially in the posterior area of the mouth, you can combine the monolithic workflow material with the technology. So your workflow become efficiency and also
faster.
And
just to sum up what we have just said, these were the classic 15 steps of the traditional workflow, in where not only we had 15 steps, but the quality control of what we were doing was always after the impression was taken, and also always after that the master model was produced.
Yes, I remember this kind of traditional workflow. If you want to deliver a PFM restoration, obviously you take 15 passages to deliver the crown, because you have to check every step, the bespoke phase, the
framework,
and so the check of the occlusion, and also several passages in the impression taken.
And thanks to this digital revolution, we were able to bring down these 15 steps down to 5, down to 6, because you see here we were taking the impression, and then through the monolithic evolution, through the monolithic material, we were able to cut several passages, and so by shortening passages, we were improving the accuracy, because remember that each passage that we are doing on a daily routine, even if we are doing at our best, even if the best lab technician is doing it, is inserting in the workflow a small mistake.
Yes,
and so
yes, because when you take the digital impression, you detect the master model, because when you take the impression of the patient, of the mouth of the patient, you detect the master model, and then immediately you can send the information to the lab, and the lab in the CAD can design the project, and then produced through the milling machine or through the print machine, the final crown, and then you can deliver without model if you manage the posterior teeth in maximum incubation, simple cases. And so you take 2 or 3 appointments to deliver 1, 2, or 3 crowns in the back of the mouth.
So what is the first take-home message here? Digital dentistry already changed our day of work, our daily routine, because it shortened passages. It made ourselves more predictable and standardizing our daily routine.
Yes, because if you use a monolithic, you don't use the feldspathic ceramic over the zirconia substructure or over metal substructure. So you avoided the interface. So the dentistry, the digital dentistry go forward to reduce the interface. Also matrix connection, no? Has been designed through this kind of concept.
Absolutely.
Reduce the passage, reduce the interface.
Because digital dentistry is great, but it's very dynamic, so it's very fluid. So we need to be constantly up to date, and we need to double check and understand which are the possible weak areas in order to improve and to increase the accuracy. And let's discuss about type bases, which are a key point of the digital workflow that we have just explained to you. Of course, they are simplifying our CAD/CAM workflow due to a standardized control. They increase the mechanical stability in the posterior area, and as I said before, they today represent the 68% of the abutment used in the market.
Yes, obviously it's very important to understand the shape, the mechanical retention of the titanium base, the higher,
the height
of the titanium base, the color of the titanium base, and so you have to cement the titanium base inside to the monolithic crown, and so you have several passages, several characteristics that can bring versus mistakes.
Exactly. In fact, how accurate is the cementation, and what does the cementation is bringing into our workflow? And there are many different articles which were published. This one is in 2020 by Christoph Ammerle and Ronald Jung group from the University of Zurich, which is clearly identifying gaps as a result of the loading process after 5 years of aging in 1/3. I said 1 out of 3, which is a huge number, which has affected the cementation interface. So what just Alessandro told you, we should reduce the interface, because every interface can create an issue. And so this is what we need to be very careful of, and this was exactly what the matrix researchers were looking to reduce or to eliminate in order to increase once again our overall accuracy.
So probably this kind of cementation interface must stay away to the implant head of the implant head. So stay away with the titanium base and the connection, the cementation interface. Stay more coronal.
So you see how many things that we have learned in our, and we are keeping learning in our digital experience, and you see that of course T-bases had some limitation. Alessandro just told you that we needed a versatile T-bases with a different cuff heights, for example. We have anyhow a limited design flexibility. We have sometimes an aesthetic disadvantages due to the titanium abutment. We have, and we have seen, it has been also demonstrating a risk or an increased risk of inflammation or debonding due to the cementation. And the more things we're utilizing, the higher is the cost. So remember what we have said at the beginning. We need to have something which is smart, simple, and predictable. and also that the time cost efficiency ratio should always on our side, should be a win-win relationship when we approach with digital dentistry. And so another sum up, second take-home message of the day, which are the digital implant workflow key points? And let's see them one by one when we need to finalize the restoration. We have the phase of intraoral scanner, we have the scan body, we have the phase of the design, we have the phase of milling, we have the 3D printing phase, and we have the T-based cementation phase at today. And you see that every single moment has an intrinsic mistake. Do you want to comment on this, Alessandro?
Yes, so we have several passages. So it's important if you have the possibility to avoid some of these passages. For example, the titanium base in a matrix, new matrix design.
Exactly, and this is exactly what guided to and brought to the matrix evolution. No abutments, no cements, and this is absolutely a one-of-a-kind revolution in implant dentistry.
And also the aesthetics, because you can place the monolithic zirconia or PMMA over the head of the implant. So in the soft tissue tunnel, you have a transparent component, no gray components due to the titanium base.
So we are simplifying our life, remember, simple. We are increasing our performance, so we are standardizing once more the workflow. We are increasing the aesthetic because we don't have any more limited design, and also we are speeding up the process because the immediacy here can more and more being achieved. And so if we look back at the slide before, if we are able to remove the titanium base, the cementation, and the milling, we are able to decrease the potential mistake by 73%. So from 90 microns of potential inaccuracy, we can bring it down to 25.
And obviously increase the time and cost efficiency.
So you understand now why this technology is a disruptive technology, because it's changing completely, or it potentially can change what has been established so far by digital dentistry, improving it. And so let's deep dive in the matrix idea with its two concept, the bone level, the implant bone level concept.
Yes, the same connection in two different morphology, bone level and tissue level implant. And look at tissue level implant, the nice design, the tissue level part of the implant with concave shape, concave form, anodized color, pink, anodized space. Very beautiful for aesthetic and to
also probably useful
create,
for flapless as well.
Yes,
could be useful
and to
for
create a space for the soft tissue around the connection.
So let's see what have been our experience in this last year, showing the Alessandro is stupid, showing our case experience. Here is the first case, the very first case that we have done, and these were like a bone level, two bone level implants in lower left mandible.
Yes, we divided the characterized tissues in two parts, lingual side and vestibular side, to increase the volume, increase the thickness of the soft tissue around the implant to recreate a good papilla and good inter-implant soft tissue.
After that, we waited, of course, for the osseointegration, and we started the digital workflow. We started the digital workflow with what? Scan body, as we have seen, is an important part of the digital workflow. And so 3Implant also created this 3D touch scan body, which in this transitional moment of dentistry can be used both for traditional or digital impression. And you see that, of course, it's very important to always double check the position of the scan body with the X-rays, and then detecting the surface of the scan body with your scanner. In this case, in all the cases that you're going to see today, it's a iTero 5D, and then send it to the lab.
Yes, it's very important to concentrate our mind, our brain in the target area to detect very well the corona part of the scan body and also the contact point of the adjacent teeth.
In fact, the scan body, every scan body in the market basically is made by 3 regions. The most important one that we need to detect is the scan region, which is the main component, which is used to digitally register the orientation and the angulation of the implant. Then we have the body of the scan body, and then we have the base. One nice thing of this scan body is that is one piece material, so only one material, and also is a titanium that goes against the connection, so making it even more accurate.
Okay, and the matrix scan body has one single component, metal component, anti-reflective surface to detect very well the surface through the intraoral scan.
And here everything has been sent to the lab. You see in this case Francesco Golfarelli, which worked with us and also work with the matrix engineer extensively.
Yes, it's not easy case because the space is not a regular space to project a good shape of teeth around of this kind of space. But the Golfarelli, you see the Golfarelli design through the card.
And what Olga was mentioning in the introduction of this webinar is very important. Start working with their certified lab, because of course, like every innovation, you need a learning curve and you need to understand what can be like the weakest point. And so Pier Francesco made a great job with their engineer, like improving and improving and improving the libraries at the CAD, so in order to avoid mistakes during the restoration. Moreover, another important aspect, first of all, which are the torque requirements? Here you have an overview of the torque requirement. And another nice thing that was developed was that there were developed different screws depending on the material. In this case, you are seeing this PMMA material, but we have like screws as well for titanium, for PFM, and also for ceramics. But anyhow, here you have like a sum up on what you should know, especially about the torquing requirement of this technology.
Yes, you can see the root form and the root shape of the implant. It's very important to place the implant with 40 Newton centimeter during the insertion, the implant insertion, to avoid a great pressure to the bone, and you can deliver your or provisional restoration or final restoration with dedicated screw torque
driver.
And
here you see that was like, as we mentioned, like the very first case that in where we have tested this implant, and you have seen the full workflow on this. You see the provisional in position, the X-ray control, and you see the nice shape that Pier Francesco was able to give in the emergence profile and also on the connection. But moving forward with our matrix experience, let's see this second case that was a little bit like more tricky in the upper arch of this failing forced bicuspid.
Yes, here you can see a post-extractive implant procedure, and after remove the root, the compromised root, and clean very well the socket, you can place in the right position the implant in terms in apical coronal dimension, mesiodistal and vestibular and palatal side. The implant head at the level, in this case, because is a bone level implant, at the level of the bone crest. And we
pack some bone,
rise a minimal flap to see very well the defect around the socket, and pack it into the socket the material, the osteoconductive material, try to stabilize the blood clot inside around the implant surface,
and then placing the provisional restoration, which was cemented, because we have like waiting for the osseointegration, and in between the patient never left our office without a tooth, because you see that there was this bridge which was holding on the second bicuspid. After that, waiting for the osseointegration, we were able to start finalizing this case as well with what? With the digital impression, because remember that every digital workflow always starts with the digital impression. And so it's very important to understand the scan protocol, and this was the scan protocol that was utilized for this specific patient. Of course, you should start.
Yes, we start with the upper arch with provisional in place, the lower arch without scan body, and the bite registration. Then you remove the provisional restoration, and you have to scan the scan body in place with the abutment, the adjacent teeth abutment, and then the high resolution scan body scan. This another scan, very important scan to detect the minimal details around, especially around the teeth abutment, the tooth abutment.
And let me tell you something more about the scan body, because you see that these were the very first cases we were doing with the matrix. You see that there was like this 3D touch scan body, which was height. And so when we work digitally, we always like to have like a shorter scan body. This was discussed with the matrix engineer, and nowadays we are able to have like a shorter version with a shorter screw. So it's also increasing and facilitating the digital impression. So you see, as I mentioned at the very beginning, digital dentistry is very dynamic. So we need always to understand which are the possible limitation of the workflow, and understand them and improve them when it's possible. Moving forward, you see the matrix full digital workflow for this specific case. We have the intraoral scanner, we have everything sent to the lab, and you see once again Pier Francesco working and designing the final crown for our patient. You see the peculiar design and why that's really key. You know, that's really key to have like a milling strategy and working with a certified lab to recreate this beautiful concept, this beautiful color in the connection, in order like to maximize your matrix experience. You see how nice it looks after that.
How nice the surface of the connection is smooth, very clean, very performant.
And that's the final crown at 1 year of follow-ups. You see, this is the healing phase. You see also the volume, the buccal palatal volume has been maintained, thanks also to the bone graft that has been placed in the gap in the surgical phase. And you see the X-ray at 1 year of control.
Yes, you can see the two single crown, one over the implant and one over the tooth abutment, and look at the quality of the soft tissue, the quality of the volume, the quality of the surface of the soft tissue, and also the quality and the volume of the papilla around the implant, around the abutment.
So we have seen so far we have discussed about the matrix bone level experience, and so what we have experienced: improved aesthetic, improved quality, simplicity, and also time and material saving, which these four aspects are extremely important. Remember, always the first slide: what is digital dentistry all about? Creating new workflow, smart, simple, and predictable. And this is exactly what we are trying to test and what we are trying to experience now. And what's next? Next is to discuss about the tissue level experience, and I would like, Alessandro, you to comment on this nice shape, as you have, because we have discussed at the beginning, you have said something about at the beginning, but this color, I think it's really nice and
yes.
Beautiful also in the slide.
Yes, look the design, the concave design, so you can leave the space for the soft tissue healing after the surgery. Also the color, the anodized pink color around the collar, and also the quality of the platform of this kind of tissue level implant.
And so this implant was utilized in many different scenarios. Clinical scenario, you see here a flapless scenario, you see here an immediate fresh extraction socket scenario, but also you will see this scenario, which I think it's a very nice case in where you will see, like, in one side we have done a tissue level implant, on the contralateral side we have done a bone level implant, but included in an interdisciplinary treatment plan approach.
This you can see the left side picture, and you can appreciate the initial X-ray. We have a deep infrabony defect around the first bicuspid, and the deep vestibular probing in this tooth. So, for my opinion, this kind of tooth was a hopeless tooth, and you can also appreciate the first molar, the first left upper molar, the distal side, the distal root of this tooth, very compromised for the periodontitis at this level. So the treatment plan is to replace the tooth in first bicuspid with a matrix, bone tissue level. It's very important to place the osseointegration surface of the implant in the bone area. This is very important, and leave the tissue level side of the implant around the soft tissue. And you can see and appreciate the therapy at the level of the molar. And this is the other side.
My mistake.
Okay, your mistake, Andrea.
My mistake.
Your mistake, Andrea. So your finger, okay, place your finger in your pocket and not in the computer.
But
please.
I think that's the side. Okay. I just need to mirror the picture.
Okay, but it's very important to prep the molar tooth. To remove, initial, you have to separate the distal root from the other, and then you remove in a minimal invasive procedure the root, and you have a sort of a moon shape of the abutment here. And in the same appointment, you can place the implant at the level of the first bicuspid.
And so you see, this is basically that side. I just made a mistake. Yes. I didn't mirror the picture, but because we wanted to show like some specific snapshot of the area. You see the half moon shade that Alessandro was talking about, and you see that in the implant side, it has been started already, the osteotomy.
Moon shade.
Shape. Here you see the implant going in position. You see also the drilling, some snapshot of the drilling phase.
Yes, it's very important to place this part of the implant, the osseointegration part of the implant, in the bone. and the other part at the level of the soft tissue.
Contralateral side, Alessandro, what was your treatment
In
plan
the
here?
contralateral side, the treatment is you have the wisdom tooth, you have to remove the wisdom tooth, we have all the bridges, PFM bridges, but we have a deep infrabony defect at the level of the mesial root of the first molar, first right molar. You can see, you can appreciate. So we have to remove this root. You have to retreat the handle part, also in the second bicuspid, and then you perform a first provisional restoration to give a comfort to the patient immediately, and then in the relaxed appointment, in the relaxed surgery appointment, you can place an implant, a bone level implant, to manage also the defect lasciato left to the from the periodontitis at the level of the mesial root. And you can see the clinic, you can see the molar without the mesial root, you can see the second bicuspid abutment, and so we manage a flap design, with the mucogingival concept. You perform the distal wedge at the level of the first molar, and then you see very well the defect and the bone crest, and perform the implant in the middle. Then you perform also the material, so the bone substitute around the implant and around the defect, and then you appreciate the stitches, the four single stitches, periostal stitches, materasaio orizzontale.
Horizontal sling.
Okay.
Here you have like some of the highlights of the bone level implant going in, so you can appreciate the color, you can appreciate the design, the threads.
Yes, it's very important to place the platen at the level of the bone crest, also to maximize the final crown, the final emergence profile crown around over the implant here.
And here we have the healing phase. You see, we're gonna focus more on the tissue level workflow. The bone level is the same, but at the end we're gonna show you both right and left side. And you see here, this is the healing phase, and we have to detect a digital impression.
Yes, look at the healing phase, look at the soft tissue around the abutment, around the implant. You look at the contour, the contour around the implant and teeth, and look at the positive architecture around the teeth abutment.
What about the digital workflow? You see, once again, now we have this always old 3D touch scan body, but nowadays we are using the new one, and in where you see like let me go back so you can appreciate it. So you can appreciate the case. You see the healing phase on both sides, and then we focus on what the iTero 5D detected. You see, nowadays we have intraoral scanner, which gave us the opportunity to perfectly detect every single aspect of the area. If
you manage very well the soft tissue around the provisional restoration, you have healthy soft tissue during the impression, the digital impression. So it's very easy detect the finishing line area around the abutment, and also very easy to detect the scan region, the scan region of the scan body.
So just to give you like a sort of recipe, which are the the scans that you need to detect.
So the provisional restoration scan, the scan body scan, the lower abutment scan, and the bite registration.
And once again, everything can be sent to the lab. In the lab, there is one important step that so far we still didn't discuss which is the best fit. That is the first thing that the lab technician should do. So double check with the scan body library if what we have detected clinically is correct.
Yes, you detect some dots around the scan region, and then we have the orientation and the best fit.
And after that, they can start in designing the final restoration. And this is exactly what has been done. You see here we have the CAD design, and this is exactly the case that we are presenting so far. You see all the different, the major variables of the case are under completely control of the lab technician or the CAD designer. He can measure, he can take images. Also, just you see right now is taking some screenshot to add in our chat in order to see if we can, if we validate the project that is doing. And after that, what is doing is designing properly not only the implant side but also the natural dentition side. So creating a smooth emergence profile, creating nice area for the hygiene maintenance, which is very important in this kind of cases, in all cases, but especially in this kind of case. Well, after that, what's next? The milling phase. Milling phase, which once again should be, it is critical. It is critical. It is critical in the sense that, once again, I suggest you work with the certified lab that Olga suggests you at the very beginning in order to understand the full process, in order to obtain such nice results, such nice connection at the end of the milling phase. Because there are many different tips and tricks that can help you in obtaining this kind of result. And after that, we are able to show you the 1 year follow-up, always on the right side, but then we're going to focus also on the left side. But you can appreciate here the x-rays, the clinical portion, everything in one single slide.
Yes, you can appreciate the color of the soft tissue, especially at the level of the tissue level implant, where we have only 2 millimeter of soft tissue tunnel. Remember, we use in this area the tissue level implant. And look at the color; it's beautiful color because we have zirconia, but also we have a anodized pink color of the implant in the tunnel.
And to sum up this case, we have placed like both sides, so you see, you can appreciate both area, and you see the X-ray story of this patient.
Yes, you can appreciate the bone healing during the therapy. So at the beginning, after the perio and the implant treatment, and after the final restoration deliver, and you appreciate on the left side the clinical side, the color of the soft tissue, the surface of the color of the soft tissue, and also the tooth proportion and the space of for the hygiene maintenance to the patient.
So it's almost done for us. And what is the take-home message? For sure, to join this disruptive technology, understanding, having a learning curve, understanding which patient can benefit of this technology, understanding how this technology can benefit in your daily clinical routine. And you see they thought about simplicity, they thought about predictability, they thought about every single aspect in order to improve a digital revolution and a digital workflow that was established with titanium base, and now we are trying to improve, erasing the potential leakage of that workflow. So
we have 6 characteristics in this slide: smart lock, slim neck, mill fit, smart bolt, Proflex, and power base,
which were also discussed by Olga at the beginning. And our take-home message is absolutely this one, that the future is now, because as we said, digital dentistry is very dynamic. We can't stop. We need to focus on what is working and what can be improved, and absolutely removing an interface can improve, because we have showed you that we can improve the 70%, we can decrease the potential mistake of the 70%, and we think that this is a huge number. So we thank you very much.
So it's very important to immediately get in the digital training, get in the digital technology, get in the new implant design, so matrix design. So thank you for your attention.
Yeah, we believe that this is a digital concept. It's not just a new implant, it's really a digital concept that is perfectly consistent with what the world, the dental world is giving us to us. So thank you very much. This is our contact. If you want to send questions or any doubts also in the future. But Olga, I think that now we have like time for question and answers, right?
That's correct. Yeah. Thank you so much, Alessandro and Andrea, for a really great introduction into the matrix world and sharing your fantastic cases. Not only implant placements, I think it's very interesting that half moon design of the shape of this one case where you have the semi extraction of the root is, I think, also surgical wise super interesting. There is some questions. My personal first question is, will you teach about the matrix and in the future in the digital workflows? Do you plan any courses for this year to do?
You know that our facility is close to the Ferrari factory, so anytime that we can organize something, I'm sure that
also we renew the ambience, and so very we improve
the training center, we improve the characteristic of the office, and so you've been here already, Olga, but you will not recognize the office because we changed it completely.
Yeah.
Okay.
Always.
Both in Modena and Sassuolo.
So you know, when you guys want to organize something, we are open. We can do live surgery. We can do in one day, showing you really what this workflow is all about. Pier Francesco Golfarelli is always available, and it can be present. But also the nice power of digital is that when you were here, the lab technician was not here, but actually was here because through TeamViewer he connected and show us the CAD design. So
yeah,
yes,
that's a serious question of the audience. They saw that you do this immediate loading on with a temporary on top of the tie base, and how is this possible if you do not have the laboratory in house? So how you organize that when you place a matrix implant, I mean, you save time because you don't have to cement and to create a model. You can do that very quickly. But how is it possible with a laboratory which is I don't know how far away? That's a question.
Yeah, you know, you can do it. It takes 2 hours, but you can do it because you have to. Yeah, more or less 2 hours, because we don't have the lab here, but the lab is 15 minutes away from our clinic. So while we are doing the surgery, we take immediately the impression, and then we send everything, and the lab then comes with the chip the crown with one of these guys. It takes, of course, like a couple of hours because we need to give the design phase and the milling phase. There is time. Or another aspect that you can do if you do a full guided, I mean, you can have like a prefabricate provisional restoration with a tolerance, and then after the implant is placed, you can reline clinically the provisional restoration.
Then there's one question about this special concave tissue level design, which the matrix, which you see maybe in the background, this concave design is the question. Would you place also this tissue level implants in aesthetic zones due to the colorization, and also play the possibility to place it a little bit deeper subcrystally? Would you place
Yes,
it in?
we utilize the tissue level also in the aesthetic area, but we position the tissue level part at the level of the soft tissue. So the tissue level side or head of the implant must be 2 millimeters below the gingival margin. And so you can create a great emergence profile of the crown. And also the tissue level implant is a great implant in the perio patient because you take the connection corona to the bone, and you can remove the crown several times for the prosthetic treatment, and you stay away to the bone, and so the bacteria stay away to the bone.
Okay. Did you had any failures or fractures due to the fact that you only screw it here in the matrix connection into the inner connection? Did you had a failure so far?
No. So far, no fracture.
Yeah. I know, I mean, we were very close in the developing phase or in the limit market release phase, and it's what we really have to mention here again, it is all about the milling. It is absolutely important that you get certified by TRI if you are if you want to have a laboratory milling in this perfect connection fitting. It's necessary to be certified, otherwise you are not even allowed from our side to start with the matrix. It's very important, and if this is the case,
it's very smart also from your point of view. It's very smart this, because I remember like the very first intraoral scanner, you know, they were saying the intraoral scanner doesn't work because at the end maybe the crown was not fitting, but at the end of the story was not the intraoral scanner fault. There was like some small inaccuracy in between the intraoral scanning and the delivery of the crown, that there were some mistakes, and so it was not the poor intraoral scanner fault, but there were some mistakes in between. And here the same thing, because maybe if you don't have the right milling strategy or the right milling machine or the right experience with this kind of library, you can experience some chipping in the connection, and it comes out from the milling machine chipped, and you say, okay, this is not working, but actually it works. But of course you need to know how to make it work. So
yeah.
very smart.
Yeah, I think yeah, and as we just said during this presentation, you were still presentation at the long version of the scan body, which we improved due to your inputs in the limit market release phase. I think this is also very great that we are very fast in developing in this digital world. Everything goes faster, so we have to be fast in creating new steps and new good designs for it. And yeah, we have a shorter one. We have even the shorter screw, which also improved. Also, the design is improved, that the scan bodies can really recognize absolutely one-to-one the situation in the mouth. And that leads me to the last question, maybe. How many implants, you know, in a case you would scan intraoral or oral? Because it's always we cannot go for full arches intraorally, which we already did, so we can do it, but it's a little bit tricky. But how many implants in a bridge or something you would intraorally scan?
But you know, it depends. First of all, if they, I mean, you said full arches that are tricky, but we say 4 to 6. And when it comes like to an implant bridge, I mean, that was the very first slide. We have 3 implants, one next to each other, and that they were scanned, and no problem. Also because they are on a line, on a straight line. The difficulty is when it becomes like an arch. So you have the curve of the arch, so that's another variable, but that's another webinar actually.
Yes, there is always a learning curve, Holger, there is always a learning curve. So you have to start with one one implant, one scan body, and detect the scan body with the intraoral scanner. Or use the intraoral scanner every day in a hygiene session, in hygiene department, or for the study model, no? And so you acquire acquisition. You acquire the experience and your attitude in the mouth of the patient with your handpiece, and then you improve and the complexity of the case.
Yeah, that's correct. Yeah. I would just like my personal last question. I hear that you are working on a book. When will be this book available, and what's the topic of it? Maybe you can get into it. And is the matrix in there as well? That's my questions to you.
So the topic, I think you can guess it. And it's the second book. It's the second part of the first book that we have published in 2014. So it's Digital Dental Revolution 2.0, and it's coming out in May in Italian version. So the Italian version is going to come out at the end of May. Matrix is going to be inside chapter 2, in where we are discussing about all the different tools that are able that we need to have like a digital workflow. So probably by the end of the year it's gonna come out in English as well, and so for sure I will let you know anyhow.
Thank you very much to Italy. I will just say, yeah, I had more question here, and I think we will pass these questions to the Agnini brothers and answer them via email, or if it's questions TRI based, I'm going to answer them after this webinar. And I just want to take the chance due to we are here all together. I want to like to announce that there is an upcoming course, a 2 days course, which we had to, due to the COVID situation, we had to exchange it from a winter excite course in the Alps, in the Swiss Alps. We had to switch it now to Zurich, which is a beautiful place as well. It's including a production site visit of TRI, because the production site is in Zurich more or less. And this is from single crown to full arch. It's also, I would say, 90% only matrix, with one other key opinion leader, Dr. Joel Telles, on the 28th and 29th of April. And please feel free to contact us at www.tri.swiss. We are always available for you if you have more questions, if you want to have more information about the matrix system, or any courses which we have upcoming, and also the next webinars. Please stay updated and get in touch with us through Facebook and all the different digital possibilities to be in touch. Thank you again, and have a great afternoon, and I hope we can see us in reality soon. Thank you very much.
Yeah, thank you, Holger, and thank you, the Matrix team, the 3 team. Thank you very much.
Yeah. Bye. Thank you.
Bye-bye.